Well, people are still talking about Joan Rivers. I mean, it's hard to believe she passed away. It happened 2 weeks ago today.
She was under anesthesia for a scheduled endoscopy when things went wrong.
Yeah, Dr. Gerard Stanley is here today, and we're going to talk about some of these different types of techniques and procedures. He's the medical director at SCULPT. Good to see you, Doctor.
Nice to see you.
Good to see you guys, too. Thanks for having me.
Patient safety is the utmost priority for you guys.
Yeah.
You guys do this minimally invasive cosmetic surgery. I guess, why do you practice this type of technique?
I think the big thing is it's a bit of a misnomer where people get confused. Is minimally invasive still surgery? Is it not surgery? It's still surgical procedures. The difference is we've really turned the whole surgical procedure on its head. So instead of every surgery requiring general anesthesia or heavy sedation like with the endoscopy case, we do a lot of things under local anesthesia, whether it's liposuction, skin cancer surgery, breast cosmoplasties and augmentations. We do everything with patients awake. So it's just really a way to say, let's change how we're doing the surgery, let's slow down, let's make it safer, let's take away all of the large risk to really minimize the risk for patients as well as maximize their recovery. So it's just a different way.
Sense. What about recovery times? What's the difference there between these different techniques?
I've seen recovery times that, even as a surgeon, it just astounds me. We've had patients do tummy tucks and be back to work on day 3.
Wow.
So and a lot of patients are still, after general anesthesia, groggy and nauseous from the general anesthesia, when we've got patients up off pain meds walking around saying, I just can't believe how easy that was.
Yeah, I'm not a doctor, obviously, but why is this method, why is it safer than going under the general anesthesia? What makes it that much more safe?
Well, general anesthesia is very safe, and there are certainly procedures that you have to have general anesthesia. And I think the specialty of anesthesiology has really done a great job at really pushing forward and leading the way in patient safety. But that doesn't mean every case needs to be done with general anesthesia. If we can do a procedure with local or regional anesthesia, as we're seeing with a lot of our orthopedic surgery colleagues doing more regional anesthesia when they're doing joint replacements, we're taking it to that next step, saying if we can do this under local anesthesia, it's a little bit slower. We handle the tissue a lot more gentle. It's just a much more pleasant experience for the patients. They just seem to recover and get better quicker.
But the results are still incredible.
The results are still incredible.
With lower risk,
With lower risk.
Some before and afters that we'd appreciate if you would take us through. What are we, obviously here?
Obviously,
this
is a tummy tuck. So this is a tummy tuck. She's about 6 weeks out from the tummy tuck on this procedure.
How did this work? Is this all from the tuck, or was this in combination with weight loss? How does this work?
This was actually one procedure. We did this in the morning.
Wow.
It's a liposuction-assisted tummy tuck. So she's awake and talking through the whole procedure. And you can tell she's just absolutely ecstatic with her results.
That's incredible.
It is. That's amazing. So, the arm's another issue for women, you know, especially as you get older, or even if you gain weight and then lose it and you've got all of that skin left over.
This is a gal who had a little bit of excess weight. She'd done a lot of really helping lose weight, really getting healthy with herself, but this just bothered her. We did this whole procedure. She was wide awake talking. She couldn't be happier.
Wow. That's just amazing.
Yeah, let's see.
So online, it's sculptomaha.com, and there's a lot of information there about the different services and procedures which you and your colleagues offer at SCULPT. Yes. But you also brought us a special offer today, and I think it's great if you want to kind of get in and try it out, meet some of the professionals. And it is, by mentioning the Morning Blend, you'll get a free 60-minute facial or massage when you book a surgery.
Which brings up another point. It's just not these minimally invasive surgeries.
Yes.
There's, you know, they
Pamper.
Right, yeah.
It's called pampering, Mike.
That's what it's called.
We love that. Let's show you some information about SCULPT too while we're looking at a graphic. SculptOmaha.com, again, that's the website, but we'll show you the address and show you the phone number too in case you would like to call and inquire about if it's something small, great, but if this is something that you haven't worn a sleeveless shirt in years because your arms bother you and you say, that's it, I'm doing something about it, then maybe this is the time. It's 884-6700 and the address there too.
Doctor, good information.
Yeah.
Thank you guys. I appreciate you having me.
We appreciate seeing you. Thank you
always
very
good.
much.
Good to see you.